Hello, and welcome to our health and wellness series. Today, we're tackling two common yet sensitive topics: bad breath and body odor. Both can be embarrassing and socially isolating, but understanding their causes and remedies can help you stay fresh and confident. In this episode, we'll discuss the major causes of bad breath and body odor, along with practical solutions for each. Let's get started. First, with causes and remedies for bad breath. 1. Poor oral hygiene. The most common cause of bad breath is poor oral hygiene. Food particles left in your mouth can cause bacteria to grow, leading to foul odors. Remedies. Brush your teeth at least twice a day with fluoride toothpaste, especially after each meals. Make sure you scrub your tongue properly with the toothbrush. Brushing only your teeth without the tongue will not completely take away bad breath. Floss daily to remove food particles and plaque between teeth. Use an antibacterial mouthwash to kill bacteria. 2. Diet and food choices. Foods like garlic, onions, and certain spices can contribute to bad breath because they contain sulfur compounds that linger in your mouth and bloodstream. Remedies. Limit intake of odor-causing foods. Drink plenty of water to help wash away food particles. Chew sugar-free gum to stimulate saliva production, which naturally cleanses the mouth. 3. The third cause of bad breath is dry mouth, xerostomia. Saliva helps cleanse your mouth by removing particles that cause bad odors. When your mouth is dry, bad breath can worsen. Remedies. Stay hydrated by drinking plenty of water. Chew sugar-free gum or suck on sugar-free candies to stimulate saliva flow. Use over-the-counter saliva substitutes if necessary. 4. The fourth cause of bad breath is tobacco products. Smoking and chewing tobacco can cause bad breath by drying out your mouth and leaving chemicals that linger. Remedies. Quit smoking and using tobacco products. Use a nicotine patch or other smoking cessation aids if needed. Maintain regular dental checkups to monitor oral health. 5. Another cause of bad breath is medical conditions. Certain medical conditions such as sinus infections, respiratory tract infections, diabetes, and gastrointestinal issues can cause bad breath. Remedies. Treat underlying medical conditions by consulting with a healthcare provider. Maintain good oral hygiene to minimize secondary causes of bad breath. Use prescribed medications as directed to manage health conditions. 6. Medications. Some medications can cause dry mouth, which leads to bad breath. Additionally, the breakdown of certain medications in the body can release chemicals that can be carried on your breath. Remedies. Talk to your doctor about possible alternatives if your medication causes dry mouth. Use a humidifier at night to keep the air moist. Increase water intake to stay hydrated. 7. Oral infections also cause bad breath. Infections in the mouth, such as gum disease or dental caries, can produce bad breath. These infections cause inflammation and create an environment for bacteria to thrive. Remedies. Visit your dentist regularly for checkups and cleanings. Follow your dentist's recommendations for treating oral infections. Practice good oral hygiene to prevent infections. Next is body odor. Before we proceed, please subscribe and drop a comment below about this content. Causes and remedies for body odor. 1. Poor hygiene. Inadequate personal hygiene can lead to an accumulation of sweat and bacteria on the skin, resulting in body odor. Remedies. Shower daily with antibacterial soap to remove sweat and bacteria. Pay extra attention to areas prone to sweating, such as the armpits, groin, and feet. Wear clean clothes, especially after exercising. 2. Diet is another cause of body odor. Certain foods, such as garlic, onions, and spices, can cause strong body odors when their components are released through sweat. Remedies. Limit intake of odor-causing foods. Maintain a balanced diet with plenty of fruits and vegetables. Drink plenty of water to help flush out toxins from your body. 3. Our third on the list is medical conditions. Conditions such as diabetes, hyperhidrosis, excessive sweating, and trimethylaminuria, a rare metabolic disorder, can contribute to body odor. Remedies. Consult with a healthcare provider to manage underlying medical conditions. Follow prescribed treatments and medications. Use specialized deodorants or antiperspirants designed for excessive sweating. 4. Stress and anxiety also cause body odor. Stress and anxiety can trigger the apocrine glands, which produce a type of sweat that bacteria love, leading to stronger body odor. Remedies. Practice stress-reducing techniques such as meditation, yoga, or deep breathing exercises. Maintain regular physical activity to help manage stress. Use clinical-strength antiperspirants to reduce sweating. Cause number 5 is synthetic fabrics. Synthetic fabrics like polyester and nylon can trap sweat and bacteria against the skin, causing body odor. Remedies. Choose natural fabrics such as cotton or linen, which allow your skin to breathe. Wear moisture-wicking clothing during exercise. Change clothes regularly, especially after sweating. 6. Hormonal changes is a major cause of body odor. Hormonal changes during puberty, menstruation, pregnancy, or menopause can increase sweat production and body odor. Remedies. Maintain good personal hygiene to manage increased sweating. Use deodorants or antiperspirants specifically formulated for women. Consult with a healthcare provider if hormonal changes significantly affect your body odor. 7. Poor diet and dehydration. A diet high in processed foods and low in water can lead to an imbalance in the body, causing bad odors. Remedies. Eat a balanced diet rich in whole foods, including fruits, vegetables, and lean proteins. Drink plenty of water throughout the day to stay hydrated. Avoid excessive consumption of processed and sugary foods. Bad breath and body odor can be persistent problems, but understanding their causes and implementing these remedies can help you manage and prevent them. If you continue to struggle with these issues despite trying these solutions, consider consulting with a dental or medical professional for further evaluation. Thank you for watching, and remember to subscribe to our channel for more health and wellness tips. Stay fresh and stay healthy.